you can do now to prepare for after. So whether that's simple things like preparing some foods and food in the crock pot and freezing in the freezer so you have easy access to food. If you live on a two-story house, if you can move a bed down to the first floor just for a little bit, so if you have trouble with stairs, you're already comfortable. If you have any family members, a spouse that lives with you and they're fine taking care of you, they may consider taking a little bit of time off of work, or if you have a close family friend or neighbor that can come stay with you, you may not need that at all, but just so you already have it in motion before you even go into the hospital. Other considerations is, there's good documentation that you can quit smoking at any time. So if any of you are smokers, even quitting a couple weeks before your surgery can really help with the outcomes afterwards. And just being overall healthy beforehand. So we talk about eating well, trying to minimize alcohol use, not smoking. The same thing that you would counsel just at any other annual visit. Other things for your hospital stay, again, packing your bag so you have comfortable clothes while you're in the hospital. I would bring a copy of all of your important documents like your insurance and your health directors, and then we do tell people to leave your jewelry and expensive things at home. I know that can be really hard if you have jewelry that you wear all the time, but I just would hate for anything to happen to it. So if you can leave your wedding rings at home, I know that feels a little scary, but just so it's safe when you get back. Okay. So, a week before surgery, now this is a little bit of an individualized plan, but in general, if you are on blood thinners for a prophylactic reason, we do have you stop them. That's a case-by-case basis. So if you're on a blood thinner and you're unsure, we will give you specific directions beforehand, but as a general rule, we have people stop blood thinners about 7 days before. We ask that you not shave your legs about 3 days before because you don't want any folliculitis or infection from your razor or from the hair, although I don't think most people are shaving where the surgery will be, but you never know, it's good counseling. And then we do ask that you stop your metformin if you're on that for diabetes 2 days before. The night before, we will give you HIPAA cleanse just to rub all over the area.
These hips have pretty good longevity, 20 to 25 years, with, we kind of go over, what actually to expect from a hip replacement and how to have achieve longer longevity with these for them to last longer.
Can you tell us that?
In a little bit. Sorry, I'm gonna go over that in just a second.
Are they all the same size? Is it based on person?
It's based on the person.
Okay.
So during the operation, we have trial components, and based on the size of your femur, we will assess how the depth and kind of go from there. Once that leg length is achieved, the equal leg length, it's in the proper position with the trial components, then they put the actual components in. So, and they do the same for the acetabular component, the cut portion. So that just depends on the size of the person, but we have all of those in the operating room at the same time. And also we can base those sizes off of pre-op x-rays and those sort of things to kind of give us a better idea of what range of sizes we need in the operating room. In this picture right here, this is x-ray, and obviously this person has 2 hip replacements, but we take, we use landmarks, so this is the lesser trochanter of the femur here, and then this is the ischial tuberosity, and so we make sure that these are all in line during the operation, and that's how we can tell that the legs are the same length anatomically. So let me go over real quick what to expect during your hospital stay. So as I said, during surgery, we want to make sure that your pain is controlled, and you'll be out for the procedure. Before we close up, we inject a local anesthetic that will give it some local numbing to that area around the incision and the hip replacement itself. But the majority of your pain management is going to come from oral pain medications, and so the ones that we use are Norco, and that will be the first line. You'll be on that Norco scheduled after your surgery during the hospital stay, and then you'll get discharged with a prescription for Norco. And then the two other ones that we use to come to supplement that is tramadol and ibuprofen, and it's a high dose ibuprofen that gives us good anti-inflammatory coverage, and then the tramadol supplements the Norco for its pain relief effects. And we're going to go over a little bit more of a schedule and how that all works with that. Another note, if you read online, sometimes they say that you might get an epidural or regional nerve block to the area to help with pain relief during your operation. Unfortunately, we don't do these because there's a lot of side effects, and the nerves that innervate that area, there's multiple nerves, and so it's not a singular nerve that we can just block. And so, unfortunately, we do the majority of our pain management with oral pain medications after surgery. And then during your hospital stay, we also want to prevent blood clots. And so after your surgery, a physical therapist will work with you and will get you actually out of bed and walking that first day with a walker or other ambulatory assistive device. And then after discharge from the hospital, you'll be on aspirin, is our blood thinner that we use. It's a baby aspirin, 81 milligrams. You'll take that twice a day for 4 weeks. We also recommend these sequential compressive devices, and we have them here in the clinic. They're required for people who are at high risk of blood clots, meaning they've had a blood clot previously. They, for whatever reason, cannot take any blood thinners at all. If they have some kind of coagulation disorder that makes them have higher potential for blood clots. So those we are required for all, but for a person with no risk factors for blood clots, we just recommend them. So what these do is they are strapped on your lower legs, on the calves, and they just sequentially squeeze your calves to promote blood flow back to your heart, so you don't have any of that stagnant blood.
Are they plug-in or battery?
They're battery operated, and so there's a lithium ion rechargeable battery. I think it lasts 18 hours for these newer ones. Unfortunately, they're not covered by insurance. Sometimes Medicare pays for them, but the ones we provide, we offer them, and they're $225 for them. The reason that, let me go back to that. The reason that they're offered at that price, whereas if you search on Amazon or something like that, these are the medical grade ones that actually have shown to decrease that risk, whereas the ones on Amazon who were like, $60 or something like that are marketed more as leg massagers and don't have that evidence that they actually prevent blood clots. And so we offer those if you would like. We have flyers about those. If you have more questions about your risk, your specific risk, we can talk to you individually about that to see if you would be a candidate to need one of those. But the mainstays of preventing blood clots in that post-operative period, especially within that the first 4 weeks, is walking, getting up, not laying down, and then taking the blood thinner, the aspirin, twice a day.
Do you have it for both legs, even if you're only having one side down?
Yes. Yeah. So surgery in general increase your risk for blood clots just because of the inflammation that occurs, and so and especially if you're not mobile, then blood clots can occur in whatever extremity not specific to which side you're getting surgery on. And then physical therapy is also important, especially in the hospital. As I said, the physical therapist will work with you the day of surgery. So after you get out of the recovery room, you'll have a physical therapist come up to your room and get you out of bed and walking. This is typically with just a walker, and making sure that you can, transfer out of bed, being able to take, maybe a step or two upstairs with assistance and stuff like that. And then after discharge, there'll be a physical therapist that comes to your house for twice a week for the first 3 weeks after surgery, and they'll do the same sort of thing, getting your gait back to where it was, and your range of motion. You'll follow up with our clinic with either Dr. Phelps or Dr. Dwyer, or one of their PAs, and then at that point we can kind of assess where you're at in terms of your rehab, and then transition to outpatient therapy. And they will continue to work on range of motion and gait training, but then integrate in strength as well as endurance to get you back walking normal. And then throughout the whole time, they'll give you a home exercise program that you can continue to do the days you're not in physical therapy.
Do they have some place they would like to recommend for physical therapy, or we have to find them?
We use a bunch of people in the area that are very well, that we've sent most of our hip replacements to, and so that can kind of depend on where you live and what your insurance is, but yeah, we have those people. You won't have to find those yourselves.